what are three things at random that you think are really important that people might not think about that they should consider to have a successful surgery?
Prehab is absolutely pivotal. Like it's maybe the most important thing.
And that's strengthening and mobility as
Yeah.
best you can.
So that you know how to do your exercises before you
Right.
try to do them post-surgical where
Right.
everything's all messed up. Like you should know how to do your
Yeah,
exercises.
that's such a
Like
good point.
I bring somebody back for their first week follow-up and they're like, okay, so what have you done so far? And they don't even know how to move. It's crazy. The second thing I would say is the nutrition around surgery, and that's micro and macronutrition. You're building muscle, you're building tissue after this. Like you can't be catabolic. Like don't be trying to lose weight around this because, your body's going to steal it from somewhere. You're going to go into this crazy healing state where your body needs amino acids, it needs proteins, and it's going to steal it from somewhere. So you're going to steal it from elsewhere. You're going to steal it from your organs. You're going to steal it from these places so you can't be catabolic. You have to be calorie positive and you have to monitor that. And you have to look at your protein intake. You have to look at your micro and macronutrients. And there's some great companies now that are helping support us, through surgery, what that is. But that's imperative. And the third thing we talked about is just all the lifestyle, the sleep. Like, what is your support? Like, you can't be trying to, and it's unfortunate, people that can't take time off of work
Right.
afterwards, that they're trying to recover from this, then still work, and they're getting, poor sleep. But, growth hormone is secreted while you sleep. This is the main restorative. So to talk about surgery without talking about prehab, nutrition, or sleep, you're way behind the eight ball to begin with, because those are the conversations that are had with the Toronto Blue Jays. Like they meet with their dietitian who sets up their surgical 5 days before, 6 weeks after, changing micro and macronutrients throughout it. Like they have a
That's
PhD
excellent.
dietitian that's following them. And you see the difference in that. And they're monitoring their sleep. They know what their heart rate variability
Right.
is. They know how many hours of sleep they're getting. And they know how important that is when they're secreting growth factor for healing. So they're monitoring all these things, and you really see the difference.
It's such a good, important conversation to have because we're always talking about sleep and nutrition, all these things. But when you think about it from a healing perspective, it is the most crucial thing, in my opinion, that we always say it's the baseline. If you don't have sleep, nothing's happening anywhere. You also talked about a while back, we were looking at some of the products that you have that are nutritional support for pre-surgery. Are those post-surgery as well?
Yeah, so the one I use is actually a great company. It's called Proven, out of Toronto, and it was Sagar Desai, who's a great foot and ankle sports surgeon out of Humber, with his team of dietitians and nutritionists and scientists, kind of came up with what is the key micro macronutrients that you need for the 5 days before and for
Amazing.
the immediate post-op. Because there's great
Makes it
research
easy
that
for
like
people too.
a simple amino acid like arginine was
Yes.
shown to decrease infection rate. But am I going to tell a patient, okay, go get some arginine, get some vitamin C, make sure you get some magnesium,
And take them in these quantities.
and also make sure you have the app that you're taking this much protein and all. Like, forget it.
Yeah.
Take a scoop of this twice a day, 5 days before, 5 days after. So,
Amazing.
we have these pioneers that are really helping us,
I love that.
navigate these things. So,
I love that.
so I have the dietitians, I have you guys, I have the therapists around it. So, without the tribe,
It makes a huge
it's
difference.
huge.
I noticed from my surgeries coming out, there were a couple things. Well, first of all, I used ice. It was a C-section, but I made sure to rest. Tim can attest to this. Is like I was like, okay, you're not at work. You've got the kids because we had toddlers at home for the third one, and I would ice, and then I'd go walk laps around the house because that's all I was kind of allowed to do. And then nutrition, I was doing smoothies. I was doing all the right things for that. This was many years ago where we didn't have these types of products, but I was able to do it myself because of what we do. And I also was using support. Like, so because with the incision, I found that I just use a simple tensor bandage. And as soon as I had it on, I could do way more than when I didn't have it on. I remember going back, you have to go to these follow-up. I remember saying to the nurses, I said, a tensor bandage costs $2. And it was a game changer for me. And why don't you tell women that they could use a tensor, they could eat well, and that they could move a bit and use some ice a bit to help, deal with some of the incision and inflammation. It's incredible that it's not out there.
It's incredible, but that's why it's so important to have your allied health,
Yeah,
for
I agree.
anything. Because put that on more on the nurses that are doing a million things, and
True.
more on the doctor
Yeah.
that's just trying to get through.
Yeah.
That's why it's so important that
Yeah.
around your surgery, you can have this health team that's helping you
Yes.
to give you those clinical pearls, to tell you these little
Yes.
things that unfortunately they don't have time.
It's
Like
true.
our system is like,
It's
time
true.
is gold.
Time
So
is not
we're trying to
there.
get the surgery and the base done. Everything else, like, you're on your own.